Good evening, everyone. My name is Leia, and I will be your host today. Thank you all for making time to be with us. Before I go on to introduce our speaker and perhaps some rules during this talk, I'd like to pass on to Prafang to introduce who we are and what we do. So over to you, Prafang.
Hi, everyone. Welcome to the talk. And this is one of the mentoring programs activities. And this is the Global Leadership and Mentoring Program. We started about 3 years ago. I'm one of the founding uh, mentors of this program. We got early career physicists and scientists all over the world join us, and the number is expanding. And the goal is really to mentor them to assume leadership position for them to grow not only academically but also holistically in leadership, in building relationship with another, and also most importantly, the mentees across the world will build up very good relationship in interdisciplinary collaboration with others as well. Also, they grow in their stature as scientists, be it in the academia or in the industrial or other sectors. And we are very privileged to invite Professor Ioannis Sechopoulos, sorry the name, uh, to give us a talk today. I'll let Leah, who will chair this session, to introduce him. Over to you, Leah.
Thank you. As Prafang mentioned, we are a program with a group of individuals, and you can feel free to check us out on our social media platforms, whether it's Facebook or Instagram, on our YouTube channel homepage. And please like and subscribe this video to access our upcoming webinars or any of our past webinars as well. But once again, thank you all for making time. We are so happy to have you with us today. Um, just a few house rules before I introduce our speaker. The talk will be around 40 minutes or so. After which, if you have any questions, we will address them at the end of the talk. If you have any questions or comments, feel free to leave them in the chat or the comment section on this YouTube video, and I will flash them up during the Q&A session. Now, without further ado, I'd like to introduce our speaker today. It's an absolute honor to have Dr. Ioannis Sechopoulos. He is an associate professor at the Department of Medical Imaging at Radboud University Medical Center, where he heads the Advanced X-ray Tomographic Imaging XT Lab. He is a deputy editor of the journal Medical Physics and is on the editorial board of the Journal of Radiology. Furthermore, he is a scientific advisor to the Dutch Reference Center for Screening, LCRB, also in the Netherlands. He has 75 international lectureships, 87 published journal articles, 115 conference abstracts, 5 book chapters, and 27 conference proceedings under his belt. So without further ado, I'd like to invite Dr. Ioannis.
Thank you, Leia. Good evening to you, and good afternoon and good morning to everybody in the audience. I would like to thank you and Professor Ang and Dr. Jocelyn Cerqueira from Brazil for this invitation. It's very exciting to talk to everybody here today about this important topic in our field, which is publishing our medical physics research. So thank you very much for spending some of you even Friday night with us, and hopefully you'll find that this is worth spending a Friday night on this topic with us. Um, so just a quick outline of what we're gonna discuss today. I'm gonna open up by giving some tips and thoughts about publishing your research and every aspect from the beginning of thinking about research to publish to some details about preparing manuscripts and such. And then I actually reached out to very experts in the field, also highly involved in the publishing research and especially in the medical physics journal, to contribute some slides that I've seen them present before or that are relevant. And I'll give you more details when I get to those. So one of them is about preparing graphs, and the other one is specific topics about the journal itself and its reorganization. So as I said, first of all, some general thoughts and tips about publishing research in general and maybe specifically medical physics research. I should say, first of all, these are my own opinions. This is not necessarily the official position of the journal Medical Physics or of my institution of the APM or any of that. These are just my thoughts, and hopefully you'll find them interesting, even though you might disagree with any or all of them. That'll be fine. And as Leia said, we'll have plenty of time to discuss and argue towards the end. So the first thing that I always say is, well, let's say you had an idea to address a medical physics problem, and that is what hopefully will result in a paper eventually, and hopefully it will result in some development or product that will impact human healthcare. But the key thing is that the reason I bring this up this way is that you have an idea to solve a problem. You don't have an idea to write a paper, hopefully, or at least that's the way I would like to say you should think about it. So it you I would like to think that what we need to do and what we should do is first have an idea, try to solve a problem that you faced in the clinic or that some colleague brought to you that they face in the clinic, and then you design the experiments to, well, um, solve that problem, test your solution, whatever it is, and that should lead to a paper, as opposed to the other way around, in which you say, well, I want to write a paper. What can I write it about? Well, I'll write it about this, and design the paper, and then do the experiments to be able to fill in the blanks, let's say. And that's not necessarily the best way to do science. I think you should first develop an experiment, just because the right way to do that experiment to get the right results to be, as I say right now, to convince yourself first of the answer to your problem, and then once you can see you gathered enough evidence, then you can say, okay, now I'm going to sit down and write the paper, as opposed to the other way around. And you should know, especially when to stop. It's you do need to generate enough evidence to convince yourself, and of course to convince the readership that what you're proposing is correct or is the answer, or how good your method are. But you don't necessarily have to be able to write the whole Bible of that problem or that solution. Not every paper can or should answer every potential question or every new development in that field. You're writing a paper, you're not writing a book chapter or a whole book. So, as the saying goes in English, keep it simple, stupid, right? It's one topic, stay within scope, and don't try to do everything about that field in one paper, because it will become unmanageable. Another thing I always suggest to my students, for example, is to realize who you're talking to. Are you writing a physics paper, and therefore the people that will read it are physicists, medical physicists, let's say, or are you writing a clinical journal, a clinical paper on a clinical study, and therefore you're writing to radiologists or clinicians of some kind. It could be radiation oncologists also. And the way you write that paper would be different. There are things that you would explain in a physics paper about the clinical reality that for clinicians it's too obvious to write in a manuscript, as opposed to, for example, if you're writing an article for medical physics or any other physics journal, you wouldn't really explain what an MTF is or what it means. Whereas perhaps a sentence about what an MTF is would be appropriate for a radiology journal. For example, hopefully in a radiology uh, article, you're not really talking much about MTFs, but if the need arises, then you can explain more physics concepts. And this is true not only in terms of medical physics and radiology, but also radiology and many other clinical journals have a medical physics section, but they're still clinical journals, so you do need to pay attention to where you're sending your manuscript in the moment you're going to write it. One thing I always like to say is that less is more, and this goes together with the other rule of keep it simple, is you don't have to start from the way beginning. And what I mean is this, and I've seen this, maybe I'm exaggerating a bit, but not too much. You know, if your paper is about X-rays, we don't need to start all the way from when X-rays were discovered or how an X-ray tube works, or start giving an introduction that is relevant to your topic. To use another example, I've read manuscripts, for example, that are about uh, breast cancer treatment or breast cancer, well, let's say about breast cancer treatment, and the introduction of the paper starts with talking about screening. And that's not really necessary. After screening, there's diagnosis, there's biopsy, there's so many multiple steps that there's no reason to start all the way from the beginning when the topic is much later in the clinical workflow. Uh, there's, of course, in the methods and materials, the rules should be that the methods should be clear enough and detailed enough that somebody that reads your paper should be able to replicate your study. But also, you should decide, okay, does the average reader of this journal need to know these details or not? So, there is a you could go too far and too much into detail in methods and materials. And if the answer is, well, only 1% of the readers want to know this because the only people that need to know this or won't know this would be the people that are exactly in your subtopic of your field, then, well, do take advantage of the online supplement option of most, if not all, journals by now. So very detailed things, exactly how, every little step of how you calculate an MTF or an NPS or things like that could go in an online supplement. And in the methods and materials, you just give the basics, the basic overview of what you did. Um, the results, it's always very good to follow the same order that in which you describe the methods. And the results, and necessarily the interesting part of the results are usually graphs and figures and tables. So, as I said, little text is okay. Sometimes it happens that I look at manuscripts from one of my students and they're like, well, my results are almost empty because all they do is refer to figure this, graph that, and table number two. And that's okay if that's the sort of results that your study resulted in. Um, that's fine. And one thing that is commonly done and that I push back against as a reviewer or as a deputy editor is uh, that people put all the numbers in a table, but also repeat them all in the text, in the results. And that's not necessary. If you present numbers in a table, then don't put everything again in text. Just highlight the important ones, and that's it. So little text in the results is definitely okay. One pet peeve of mine in preparing figures, and this might be very specific, but I do want to point it out, is, and I took this from a manuscript in which you're comparing different reconstruction technologies for CT, is what is wrong with this figure? Well, and in my opinion, there is plenty of space here, right next to the A and the B and the C, to actually say that the A is filtered back projection, so FBP, B is first, C is ACE. So don't make me look back and forth between the figure caption and the figure itself to so that I can figure out which one is A, which one is B, which one is C. There's plenty of space on the figure itself to write out what each image is about. So please do take that into account and allow me to read the figure only by looking at the image itself, not necessarily having to go to the caption or definitely not to the main text to figure out what's happening in that figure. In the discussion, it's a very common mistake, in my opinion, to re-summarize the introduction. uh, I don't need to read it again. I just read it 5 minutes ago. So don't tell me the whole story again, and definitely don't re-summarize the methods or the results. I just read the results a few seconds ago, so I don't need to read them again. But tell me, what they mean, what the results mean, and yes, you could say again in brackets, which number is the one that tells me why you're telling me what you're telling me in terms of a conclusion. And of course, very important is to discuss as important as discussing what the results mean is to discuss what they don't mean. So, the limitations of the paper, what generalizations are not true. Uh, all papers, all studies have limitations, and they should be specified usually in the last one before the last paragraph should be a limitations chap paragraph, and talk about, as I said, what the results don't mean and what assumptions you had to take and why those were safe, or what do they mean in terms of generalization. Um, and another thing I think important is, um, well, show me the money. And what I mean by that is, tell me why this, be sure that as a reader, when I read your paper, when I'm done, I realize, why is this paper important? Why did I just spend the last 10, 20 minutes reading your paper? If I finish reading your paper and I put it down and um, I don't find the interesting part, then you should you didn't write it in the best way possible. You should be convincing in your discussion of saying, this because of this experiment we learned this, and it's important because of this or that. Um, One thing I would like to say is, if and this is very relevant for many of our studies, if your study includes Monte Carlo simulations, then a few years ago, the American Association of Physicists in Medicine put out a task group report number 268, which was called Records. So it's about improved reporting of Monte Carlo radiation transport studies. A number of people in the area of Monte Carlo simulations for medical physics got together, and we wrote a checklist of what items any manuscript that includes Monte Carlo simulation should mention. And the checklist is, if I remember correctly, 25 items long. And it says, and it looks something like this. It has 25 items, and some are about the title, and some are about the methods, and some about results and validation. And there are requirements, or I should say, suggestions or guidelines for what your manuscript describing a Monte Carlo study should say. And some of them are as easy as it says right here, and identify in the title that there's a Monte Carlo study. Give the release number or the release date of the software used. Uh, explain the validation and so forth. So I would hope, if you're involved in Monte Carlo related research, that please go and find this resource, and that will help you describe your study in a way that will be better reviewed and hopefully accepted by the readership. Um, so I hinted towards this a few minutes ago. The key thing is when I finish reading your paper, is that I don't in my mind I don't have the final question as a reader, as a reviewer, hopefully, that to ask myself. So, uh, who cares? Um, Sometimes you do read, especially manuscripts that are about to be reviewed, in which you ask, well, fine, yes, you found a new answer to a question, but nobody was asking that question. We, as medical physicists, we are applied scientists. Nothing wrong with basic science, of course. Physics, chemistry, um, astronomy, whatever you want. But we are applied scientists, and we do applied research. And in general, it's good to have knowledge because we like general knowledge or academic knowledge. But our research should, down the line, it doesn't necessarily have to be tomorrow, but down the line should have some uh, potential for some clinical impact. And we are here, and our research is about improving human healthcare or the human condition. Um, so make it clear how your paper, your study, your experiment does that furthers human healthcare. So, changing topics, these next section, I asked Professor David Rogers from Carleton University in Canada for him to share the slides with me to show today. Uh, Dave Rogers was the deputy editor of Medical Physics for many years, until editor two editors ago. Um, and we worked together in a couple of committees under the AAPM before. And I've seen him give a presentation about preparing manuscripts, and especially preparing graphs for manuscripts. And I always that his lessons always stuck with me throughout the years, and I thought, now that I'm giving this lecture, that it was something that I wanted to share with you. So my thanks to Dave Rogers for these next few slides that I'm going to go over. As he calls them, Dave's rules for figures. But before that, he does have a few comments on preparing manuscripts that I kept these on also because I wanted to share them with you. So helpful hints for preparing manuscripts, aside from the tips and thoughts I already mentioned from myself, is of course you do have to approve, check, look at them. Many times we do find mistakes once you upload your Word files or LaTeX files. Do check the converted PDF files that you need to approve. Sometimes things go wrong and you don't expect them, so don't just click approve without looking at them. Run spell check. That is very too easy to not do. And another thing, and since this is an international audience, this is, I think, very relevant. Um, as I always tell my students are also thankfully very international. In my lab, there's people from all over Europe and now the world, and they all have their Microsoft Word, let's say, in their native languages, in Portuguese or Italian or Polish or whatever, and their PowerPoint also is set to that. So what that means is that all their text in English is underlined in red because of the automatic spell checking. Of course, finds all English words are misspelled in Portuguese or whatever it is. So that also means that typos and mistakes of typing are very hard to find because you're used to seeing everything underlined. So please, turn your Microsoft Word or PowerPoint when you're preparing slides into English before you start writing, and then the typos will be easily found, much easier than for a reviewer to find. I find as a reviewer or as a associate or deputy editor, when I read a manuscript and it's full of small mistakes like typos, it's just unnecessary and gives the wrong message. Of course, check figure numbers. We add or delete figures all the time. and it's easy to forget to update the numbers. I guess this has happened to everybody. Address the cover letter to the right editor. Um, we all sometimes make those sort of mistakes. Include your correct email address and double check the all files. As I mentioned, incorrect grammar or typos is something that just reflects poorly and makes the reading and the understanding of your manuscript much more challenging. And reviewers are busy people, associate editors are busy people, uh, um, so it's good to be careful. And if you need to check to ask somebody uh, fluent in English to check your writing, that is always good if necessary. Um, Illogical composition, obscure writing, verbose. I already mentioned this. You don't have to cover everything in the history of your field. That's quite okay, and most journals have a certain page limit that you should try to, or you should abide by. And illustrations are key. Um, a lot of readers will just look at your figures before deciding if they're going to read a paper or not. So you have to make figures as understandable as possible. Um, Regarding discussions, yes, overreaching of results. You're not going to impress anybody by you know extrapolating out of your results things that are not based on your evidence or on your results. So don't try. Reviewers will see right through it. Also, make sure you do uh, recognize and discuss and put in context your work compared to existing prior work and prior literature. Of course, don't copy paste language from somebody else. And the truth is, you're not even allowed to repeat language from your own writing. So I know it makes it hard sometimes if you are in a topic, let's say you work on breast tomosynthesis, and to describe breast tomosynthesis every time with different words is somewhat of a challenge. But you need to do that. You cannot copy paste large sections of a paper, even if it was your own, into the next paper. This is automatically checked these days by manuscript review websites. We look at it, and if we find a very high percentage of overlap, we will send it back without it being reviewed. And if that happens multiple times, we at some point will stop accepting your manuscripts. If, just as I said, a paper doesn't need to answer all questions about a field or a problem, that also doesn't mean that you should, try to get 3 papers out of every experiment. A single paper should stand on its own, and sometimes it's obvious when all you're trying to do is get multiple papers out of one piece of work. Okay, so to Dave's rules for figures. Um, as I mentioned, and he says, figures can be the most important part of a paper. Uh, a lot of people just peruse through the journal, and the figures and some part of the abstract is what makes people decide I want to read this manuscript or not. So you need to pay attention to it. Uh, so Dave's rule include uh, that labels on the axis and on the graphs should be lowercase. Uh, we all agree that lowercase is easier to read. Of course, the units and such things need to be uppercase correctly. You can see here out of these 3 lines, this is the best one, and definitely, as we know now in the internet age, this is the equivalent of shouting, and that's not nice. Uh, Always use X's and tick marks on all 4 sides. You see here, you close the square with X's. So, a lot of us, myself included, would draw a graph like this, but this is probably the best way to do it. The number of tick marks should be correspond to the accuracy of your measurements. So it's not the same to have no second or minor tick marks like this, as opposed to this sort of number of tick marks, and it makes things easier to read when necessary if somebody's is wants to check a specific number or something like that. One detail that I make this mistake all the time is you can see that, of course, the number of significant figures in the axis should represent, something. It's not arbitrary, and that significance of your accuracy measurements doesn't change with if it happens to have if it happens to be zero point 0 or zero point 0.5. So um, the number of digits or significant digits in your axis should be consistent across numbers. Um, of course, in a log scale, this doesn't look very good, and it just occupies space and is not very relevant. So do use in log scales, you should use scientific notation where possible. Um, of course, show something like this graph doesn't really provide much information of anything. So use the correct type of axes. If it has to be in a log scale, then fine. Um, and that in many graphs look wrong in non-log scale when they should be. This is very typical. Compress the data and give extra space above and below, but all it does is just show a lot of white space that doesn't provide any information. So do adjust the scales so that you take advantage of most of the space in the graph. One key thing is a lot of graphs do end up with many lines and series of symbols. So a graph like this with many lines and um, the legend, or yes, the legend over here is hard to read. This sort of suggestion by Dave, I think, is very useful to actually put next to each line what each line it means, and with little arrows or similar. That makes it a lot easier. And of course, if you can include color, then that is better. Uh, yes, you still, there's people that still print the paper to read it, and some people print it in black and white to read it. So make sure you use dash lines, different types of lines and symbols, so that when you look at a graph in black and white or grayscale, it still works. You should not depend only on color being always available. Um, okay. One typical mistake is to make everything too small and too thin. Um, so do expand, make sure the numbers and all the text and the symbols are of a decent size. You can think that you sometimes look at the graph in your screen, and that might be a certain size. But then when it's published, when it's printed on a A4, then that figure is shrunk. And if the lines are very thin and the numbers are all very thin and very small, they might not be readable. And this is also especially true for PowerPoint presentations. When you shrink a graph to fit in your slide, you might end up with numbers that are way too small for anybody to read. Uh, we all know that clear fonts, so what's called sans serif fonts like Arial, are easier to read than Times New Roman, for example. So do use those. And approximately square graphs do work better when printed in a article rather than this very narrow and especially very tall, although you don't see those very often, figures. So make sure that they use tend towards square graphs. And definitely, and this is, for example, if you do use Excel, which is not the best graphing software out there, but if you do use Excel, the default is to have a title in the graph occupying some space, and either remove it or move it into the graph like Dave shows here. And sometimes that title is not even necessary if it's obvious from the y-axis what you're displaying. But if you do have a title, do include it inside and use the space for the graph itself. Um, this is, as Dave said, a personal preference. Uh, Theoretically speaking, the units are dividing the metric of the quantity. So usually I put it in brackets, but I know I forget that Dave has taught me years ago that the correct way is to make it divided. And as I said, as Dave says, captions should be self-contained. I would take that a step further. If you can make a figure by itself understandable without even me having to read the caption, that's even better. So as I showed that example of having the CT images labeled on the images themselves, then I don't have to go back and forth between the image and the caption to understand what I'm reading. And uh, the next step is, if I look at the figure and the caption, I should understand what you're telling me without me having to go to the paragraph in the main text to understand what the figure is all about. So those are Dave's rules for figures, and I always thought since years ago that they're very useful, so I wanted to bring them to today. This last section is specific about the journal Medical Physics, in which, as Leah mentioned, I'm recently a deputy editor. So these slides are actually a contribution from our editor-in-chief, Professor John Boone, from University of California at Davis. He became the editor-in-chief on January 1st of 2021. So I thank him for these slides. And of course, we want to recognize and thank the previous editor-in-chief and the two editors, one for therapy and one for imaging, Professors Jeff Williamson, Shiva Das, and Mitch Goodsit, who stepped down from their editing responsibilities at the end of 2020. But what hasn't changed, even with the new editor model, which I'm going to show you in a minute, is that the core idea of the review of manuscripts in medical physics is still the same. There's an associate editor who is an expert, hopefully an expert in the field of the manuscript, and identifies two referees, or I should say at least two referees, to review your paper and submit comments to the associate editor, and the associate editor makes a recommendation if that manuscript should be accepted or rejected or somewhere in between. This still remains the basic unit, let's say, of a review of a manuscript. What has changed over the years, especially in the last two terms of editors, is the overall model of where this is placed. So for many years, ever since the founding editor, um, all the way to Bill Hendy, there was one editor in the journal who would oversee the work of the associate editors, who, as I said, would send out the manuscript to the reviewers. And these are the numbers that you can see of associate editors and guest associate editors and reviewers that the journal would work with. Then between 2014 and 2020, the editor-in-chief was Dr. Jeff Williamson, uh, was accompanied by two editors, one for therapy and one for imaging, and they would decide on accepting or rejecting a paper based on the recommendation, again, of these associate editors and the review team. So the work of deciding was split among the three of them, depending on the topic and the workload of each editor. Now, as I said, since January 1st of this year, this model changed again. Uh, uh, the editor-in-chief is, as I mentioned, Dr. John Boone, and we do have an editor for therapy, which is Dr. Stan Benedict, also from UC Davis. Um, and we do have a new managing editor, at the AAPM headquarters, Al Thomas, who is great. So if you communicate with the journal itself, you would be communicating with Al for the most part, and she's been great help. But what did change, aside from the editors themselves, is also they instituted a new model for the structure of the journal. So now, before we had an editor in chief and two editors, one for therapy and one for imaging, and that now is different. We have an editor in chief, of course, John Boone, and Stan Benedict, who's the editor for therapy. But now we have 15 deputy editors that receive one of the 15 gets assigned your manuscript when it gets submitted, depending on the topic, of course. And these deputy editors assign the manuscript to an associate editor who is the one who invites the reviewers. The reviewers send in the review. The associate editor recommends what to do with the manuscript to the deputy editor, and that deputy editor is the one who decides. So now we have a new stage of well of decision, which is at the deputy editor's stage. So these are the 15 deputy editors that, of course, cover all the different expertise that is relevant to medical physics, and it's a worldwide group of experts. Well, 14 experts and me. And when you submit a manuscript, you can select which deputy editor gets assigned your manuscript, and that not necessarily is a guarantee that that deputy editor will be assigned your manuscript, depending on is it actually the right expertise and or the workload of that person. But for the most part, um, it goes as you submit. Um, so as I said, you can not select a deputy editor or select one, and then the deputy editor gets your manuscript. We check it for, is it within the scope of the journal, um, and then does it comply with a number of rules, and then we invite associate editors that are experts in the field for them to identify at least two referees, and then the process starts. Another thing that has changed, or is changing as we speak, is that medical physics right now has all these manuscript categories, and of course, the typical standard research article, and then a more brief research article, which is a technical note, and many others. Um, so there's been a decision to remove some of them and change some. And so, of course, the core articles remain: the research article and the technical notes, and the scientific report of the APM. Also, more like review articles or editorials and such are by invitation only. But a number of other types of articles are being going to be retired, and some of them will fall more as review, and others are just going to not necessarily be accepted anymore. And we still are going to do book reviews and PhD abstracts, but they're going to be posted on our website, medphys.org. One other change that hopefully will be coming soon, probably after the summer, is that we're going to change the structure of the abstract. Up to now, the abstract of research articles had this structure, of course: the purpose, methods, results, and conclusions. Um, and one thing that we saw kept happening, and this is true for many journals, is that the purpose is not only the purpose, people use it also to give an introduction. So there's going to be a new section in the abstract that it's called background. So you introduce the topic and or the problem, then you be specific about what your study is aimed at, and then the standard methods, results, and conclusions. So we hope this will make writing and reading abstracts clearer. So to summarize, well, as I said, an official tips and thoughts is, science is first. Develop the science first, and design the experiments to develop what the the correct science says is the right amount of evidence. Then sit down and write your paper. Uh, Talk the right language to the right audience. You know, don't explain to a bunch of medical physics what an MTF is. Uh, be organized, especially in methods and results. And you know, don't put methods in the results section, and definitely don't put results in the methods section. And be direct. You know, don't be afraid of saying why you did what you did and why you didn't do what you didn't do. Um, and why I should care about your paper. Why is it important, clinically relevant, or so forth. Good figures and graphs are key. My students like to say I'm a bit too detailed, but I think and they are the first thing that people see when they look at your slides and or your manuscripts. And about the journal, as I said, we have a new editorial structure, and a few things are changing. Um, but you know, we're still very happy to receive your best science for it to be communicated around the world. So thank you very much. I hope you found that of interest and useful. And as Leia said, I think we have time for questions.
Thank you, Dr. Ioannis. Yes, it was very, very useful. Thank you. Um, Before I head on to the questions, I thought maybe it might be a little curious. There's
Hmm.
warm greetings from Brazil, Colombia, Vietnam, Indonesia, Jordan, Taiwan, Malaysia, and the Philippines so far. So I just thought,
Great. Hmm.
um, I I'll start with one question. The first one being, um, there are a lot of issues that in research that we need to figure out, but how do you decide the research direction? I guess any tips or important considerations?
The,
This is more, yeah, a bit more general on research rather than specific to paper.
um, okay, that's a very broad question. So the research direction in general, well, what are you interested in? What is a lot of times it just happens because you're in the institute that is expert in something, or if it's very patient related research, this is the type of patients you that actually come through the door.
Mm-hmm.
I think one, especially in patient related research, um, you have to be conscious of what patients come through your institution. So you might be very interested in in brain tumors, but if there's a brain expert center on the other side of the city and you're not it, and therefore
Mm.
those type of cases don't come to your hospital and you don't have a collaboration or something, then you're setting yourself up for failure. Um, I do think also, and as I mentioned, um, and this is true in especially because when medical physics is viewed as a more of a physics field
Mm-hmm.
rather than a clinical field, is sometimes we try to answer questions that are sound academically interesting, or let's say they just sound interesting, but they're not questions that people are facing in the hospitals and in the clinics. So as I said, in my opinion, in my humble opinion, medical physics is an applied science,
Mm-hmm.
and therefore we need to address issues where within a certain time frame, and that time frame could be far away, yes,
Yeah.
uh, are you know relevant or applicable in the clinic. So I think having a good communication with our fellow clinicians, so radiologists if you're in diagnostic physics, or
Mm.
radiation oncologists if you're in radiotherapy, is important. They are the ones who communicate what their problems are and what needs to be solved. So I think if you can, and you should try to do that, to really have a good communication with your clinical partners, and they should guide at least this the direction of your of what you're doing work in. But of
Yeah.
course, also follow your passion, right? You don't want to do research that you're not interested in.
Yeah, that's actually really useful. Actually, that's a great way to start.
Got the right members to the right audience.
I do have okay. So so there's quite a lot of questions actually in the comment section.
Okay.
Um, I'll start with okay. So Evan has asked one small question: how to tell if your finding before it turns into a paper is best presented as an original article or technical note. This sometimes is an issue when we have borderline novelty.
Hmm. Well, that I think that that is part of the answer itself. So if it is borderline novelty, but it was, um, this method applied to a new application. Sorry for the pun. In a new different modality or different conditions, then that sounds more like a technical note. Not necessarily you developed a brand new method,
You have
but
headphone for
it
me?
was applied to a
Earphone.
different
Yeah.
case set that is interesting enough to publish again. Um, Also, a technical note could be a new idea, a new development that has not been explored as deeply as for a whole original article. But you do want to put it out there, um, and show that within a certain narrow set of conditions it works. Um,
Mm.
and okay, and this is it, and you're going to expand further in an original article. And another reason to maybe have a technical note is that it is and this is depending on the journal. Um, if it's something that you think clinical, uh, it's interesting for a clinical readership, clinical medical physicists, but it's not necessarily a new scientific development, but it is a new discovery and perhaps a solution to a problem in the clinic, uh, but it's quite narrow in its application, then it could be a good technical note too.
Mm. Okay, that really addresses it actually, especially when it's a borderline. Thank you. Um, the next question is from Josie. Should I accept all suggestions of reviewers if I disagree with some points? Can I have my paper rejected?
Uh, no, for sure. I mean, if you don't have to accept all the suggestions of the reviewers, so um, no, but you should argue why you don't accept them, and if you're well, if you're right, then the reviewer or eventually the associate editor should agree with you. Um, if you dismiss all suggestions of the reviewers, well, yes, your paper would probably be rejected. Um, but yeah, no, we you don't necessarily have to agree with all the suggestions. Um, Not all reviewers are are always right, or the suggestions are always applicable, or maybe they miss something. It's good to try to be positive about all the suggestions. That doesn't mean accept them, but if it's uh, perhaps if it's something that was in the paper and the reviewer asks that to be added, or criticizes your paper because it was missing something that it wasn't missing. Well, think, did the reviewer not read it, not give it enough time, or did you not communicate it clearly enough? And then, try to be neutral about reading that sentence or that paragraph and say, could I have communicated this message better? And try to rephrase it if that's the case, and make the point that this information was there, or this is what this thing that it supposedly was missing is actually there, but okay, we tried to do a better job of communicating it. But if you feel like this is outside of scope of your experiment, it's not necessary to be generate enough evidence to show that your solution works, um, then you can definitely argue against it and push back. But explain why you don't agree, and why you don't think that suggestion would result in a better paper.
Thank you. That's actually very. It's good to know that even if we can justify it and have that like that confidence in a way that it wouldn't be rejected as long as it's pretty solid in an answer. Um, so Dr. Paulo Costa has a question. But before I show that, so he started with sometimes, especially considering students writing their manuscripts, they spend too much energy trying to do a perfect job before sending the draft to senior authors. This lack of time can put in rig the novelty of research. In Portuguese, we have an expression that is the perfect is the enemy of the good, and sometimes the draft just needs to be good. Do you have some words about it? When is the time to share the manuscript to the review of the other collaborators?
Yeah, I agree, and I would like to say how to Paulo, and thank you for joining. It would be very nice to see him soon again. Um, yes, I agree. I think, well, but I think it's part. So there's two stages, right? There's the direct supervisors, uh, under the student, and then there's the other co-authors that are perhaps external to the lab. And I agree that, especially more junior students sometimes are afraid, if I show this not perfect draft to my supervisor, he or she will be disappointed with me. And of course, and students need to understand that, they're students and they're learning, and I think in part it's up to us also to communicate that we understand, this is the first time you're writing a paper, perhaps, or one of the first times, and we don't expect perfection from day one. And you're a student, by definition, you're learning. Um, so I think it's important to communicate from us, from the supervision, that, well, first, before a student starts writing, to at least have clear that, that you have enough methods and results to at least put together uh, a first draft. And one thing that a lot of people do is agree on an outline first. So that is, by definition, a very draft, just bullet points of the discussion, and let them go back and write uh, that first draft, but you already agreed on what the outline of that discussion would be. So a collection of bullet points. And then for the introduction too, work together in a initial outline, just a number of bullet points. Make sure you touch upon this, or I don't, do you think you should include that or exclude that, and have, don't necessarily go from zero to a final draft without ever talking to the student, or the student ever talking to you in between. um, and then, of course, to other collaborators outside of your group, your co-authors from, other institutions. um, I think I do, I would say myself, this is my opinion, how, we don't send it out to our collaborators until we're happy with it within our internal group. Um, and it doesn't mean we're not open to suggestions. And of course, we'll take on all suggestions. But I do think, yeah, it doesn't, if we didn't have any co-authors, would this be ready to be submitted? That's when, we send it to co-authors. But depending also how close you're working with those collaborators. But I think it's well, in my opinion, the best way to approach that is to be open and communicate well with your students that, this is not an exam and this is not a final exam. um, you know, even if you are a very advanced, even if it's a PhD, you're still learning, you're still a student. So, thanks. We're here for a reason.
Can I comment on
Yes.
the Paulo's comment
Sure.
on his Portuguese saying about perfection is the enemy of goodness, and that reminds me of uh, a saying or the so-called maxim from G.K. Chesterton: if anything is worth doing, it is worth doing badly.
Hmm.
The late Professor John Cameron, University of Wisconsin, often mentioned this in his talks to his students. Right? If anything's worth doing, it is worth doing badly. It seems contradictory, but what it really means is just do it. Don't wait for perfection. Perfection will never come. So many of us are so perfect, like one addition n plus one n to the infinity, and we never finish it. So the odd time when we, and that's it, we are quite happy and send to our collaborators and voila, submit.
Yes. They, I just had a conversation today with one of my postdocs, and I told him, it's good to let students, hit their head against the table, against the wall, sometimes. Um, it's part of learning, especially in at the research, PhD level. Is if I protect them from every mistake, then they're not never going to learn at the level of you know uh, you know doctorate level, and the level where they become experts in a field, in their field. Um, so so even writing a paper, and you send me back the uh, you send me the first draft. Chances are, unless you're a senior PhD student, if you're first or second year, you're gonna get it back, and it's all gonna be red. And it happens every time, and it's all red and full of suggestions and comments and edits. Um, but and I do tell them, like, don't worry, this is it's your first ever paper, probably, or second, and this is part of the process, and it doesn't mean you don't know what you're doing, or or you'll never be able to write a paper by yourself. It's just a process. Um, and if you don't go through it, you'll never progress. Like Paulo says, you'll never have that paper submitted, um, because you're going to be running around in circles if you don't you don't seek the input of your advisor. Uh, or it's in the name. You're an advisor to advise.
Yeah, that was very, yeah. I think Dr. Paulo Costa's question, I think, hit home for both those who are advisors and those who are students, very much so. Thank you.
Hmm.
Okay, so the next question is from Hidetaka. Thanks a lot for your informative talk. I think you suggested the details of methods should be put in a supplement file, right?
Yes, to a certain degree, yes. I think. I mean, the very details. Yes, it depends on the journal. Some journals are clearly don't the space limitations make very clear that very detailed the methods need to go in a supplemental file because there's not enough space. And usually the higher the notoriety of the journal, the more restrictive they are. Um, but yeah, so think about it this way: if the in my opinion, if the average reader of that journal reads your methods and understands what you did, then that's okay. If they don't know, exactly how you put together the point spread, the edge spread function, that then you convert it into an MTF, uh,
Mhm.
that very slight details uh, can go in a supplemental file. Of course, if you use standard methods that everybody would use, then you don't have to give that very very precise details. Best, of course, is if you use standard methodology, is you just said, I obtained the MTF using the methods described by this and that paper, right? Um, so you should give details of your methods if they're different from what is standard or what is published out there. And if it's as I said, if only 1% of the people that read your paper are actually interested in it, then put it in a supplemental file. They'll look for it and find it and read it.
Okay, thank you. The next question is, uh, from Mayu. There are some similar journals. How to pick the proper journal when we have the manuscript needed to submit?
Um, well, so I first of all I would say decide on the journal before you start writing. Um, Usually, with my students when they're about to start writing, I say, okay, what journal are we going to send this to? And then they start writing. I think you should have that in mind first. Of course, not necessarily the first journal will accept it, and then perhaps you might want to change journal. Um, so assuming hopefully that you're not in a country that necessarily your career system, your education, well, or your institution, it's all about quantitative metrics like impact factor and things like that. That happens, of course, and that is unfortunate. But in many systems, it is it is what it is, and then you do have to aim for the highest impact factor no matter what. Um, I think a colleague of mine many years ago told me, what I think is very smart is you should publish where you read. Um,
That's a
so,
good one.
yeah, I thought it was relevant. So, the journals you read are the ones of your field, right? That's why you read
Mm-hmm.
them. So, don't go out and publish in this journal you never read because your colleagues are not the ones are not going to be reading your article.
Yeah.
Um, so and if it, otherwise look at prior issues to see if the type of manuscript you're thinking about is the type of manuscript that is the topics that covers the topic that journal has published in the last few months or a couple of years, and then uh, and eventually there's some that are very similar and um, yeah, of course, I'm not going to say you should publish in medical physics, and but no. So
Hint.
yes, but yeah. So I think I would use those kind of guidelines.
Thanks. That's a very good one. Thank you. Um, and a question from Swai. He was asking, could you offer some medical physics journals, please?
Um, well, so I mean, well, I shouldn't have started mentioning a list of journals because I'm going to forget some, and that's unfortunate. Um, so I don't think I'm going to start listing journals. Um, but I think if you well if you look at recent articles in one of them or two of them, then look at the references and look where those references where those were published, and that will start identifying you some other medical physics journals that you may have not heard of before. Or look at review articles of the
Mhm.
topic you're interested in and look at the references and see where those were published. Um, Again, I think it's best if I don't start listing journals because I'm going to forget a few and I don't want to get anybody upset.
That's fair. That's very fair. I think we're almost done with the questions. I don't know if so. Everyone's asked this question, whether the slides would be available in PDF. I think that's something. If I think we can, perhaps I could email this later, but this is something I'll check with you, Dr. Ioannis, before doing
Sure.
so.
Yes.
But I think with everyone here, don't worry, it's a YouTube link. So to a certain extent, you can always come back and review it on our channel. And you're more than welcome to send any questions as well to us. And our emails will be are on our socials. So you're more than welcome to post any questions to us, and we will forward them to you, Dr. Ioannis. Or you
Mhm.
could take down Dr. Ioannis's email also here and contact him directly.
Either.
Yes. Yes. Oh wait, no.
Yes.
Yes. Yeah, but if there's any more questions from anyone else, please feel free to post. Otherwise, Prof. Ng, would you like to say anything based on what Dr. Ioannis has said, or even from your experience on some of the questions that people have posed. Mm, I think with that, there aren't any questions as far yet. So perhaps, yeah, if there's any questions, I can direct them to you, or all of you are more than welcome to email Dr. Ioannis directly as well. With that, thank you very much, Dr. Ioannis, for this talk. I think this has been very useful. It's hit home for many. Many have said this was a very useful talk and excellent sharing, and it was very thoughtful advice. And it has helped pretty much anyone, in whether you're clinical or advisor or student. This really does hit home. So thank you very much for spending your time with us
Oh,
today.
thank you for
Yeah,
the invitation. Thank you to Professor Ang and
yeah. Thank you very
Dr.
much,
Jocelyn.
Ioannis.
Thank you. It was a
Yeah.
lot of fun, and hopefully it was helpful. And yes, for sure, you can email me or the organization, and we'll get you the answers and the PDF. Thank you.
Yes. Thank you all for coming. It was a pleasure having each and every one of you here, and feel free to like and subscribe um, to watch more of our videos, our past videos, as well as our future videos. Right. I will call this the end of the session. Thank you all once again. Have a great day, or great evening, or great night, wherever you are, and have a great weekend, everyone. Stay safe. Thank you.
Bye.
Good night to all. Goodbye.